evening, colleagues and fellow listeners. Today we're going to explore how artificial intelligence is reshaping two fundamental pillars of our society. Those two areas are healthcare and higher education. While these fields may seem different, their journeys with AI reveal surprising parallels and critical lessons about the future of our professional work. Our panelists for this evening include Judy-Ann, Shaunalee, Juliet, Farah, Carrie-Ann, and myself, Victoria. On today's agenda, we will be highlighting our two case studies, which will be our introduction, issues, recommendations, and conclusion. Let's first look at our two case studies. On the healthcare side, we have the research from Romero and his team at the Mayo Clinic in 2020. Their mission was very specific, reduce costs and harmful unplanned hospital readmissions. They were driven by external factors like federal reimbursement penalties. Their tool was a precise commercially built AI design to predict which patients were at the highest risk. On the other side, we have a case study by Chin, 2025, which gathered perspectives from education in Brunei. Their goal was much broader and more internally driven. So therefore, this was to improve teaching itself through personalization and to save time on administrative tasks. Unlike the single healthcare tool, educators use a varied ecosystem of AI applications for different purposes. So there we have it. Two different starting points, one focused on specific high task outcomes, and the other focused on a broader transformation of processes and practices. Yet, both fields arrived at the same powerful model, the hybrid professional. AI acts as the specialist identifying high-risk patients or automating grading. This frees up human professionals to be the generalists, applying clinical judgment, forecasting, critical thinking, and providing mentorship. The core insight from both fields is clear. AI's greatest value is not automating professionals out of the loop, but in augmenting their judgment, allowing them to focus on the deeply human aspects of their work. So then, of course, this brings us to the shared challenges and critical tensions. Of course, this integration does not come without significant challenges, but both sides highlight the importance of these tensions. Firstly, we see the inherent limits of AI. In the hospital, staff felt that AI's care recommendations were more just a standard checklist rather than being specifically tailored to each patient's needs. In the classroom, educators worried that the over-reliance of AI would stifle creative struggle and critical thinking. And as we both know, those are essential in learning. Secondly, we look at the ethical frontier. Healthcare grapples with the life or death stakes of data privacy and ensuring the AI model isn't biased, whereas education, on the other hand, confronts a crisis of academic integrity and the fear that AI might create a copy and paste generation without deep understanding. So finally, this then will bring us to the central tension that both sectors must navigate, and that is how do we balance the phenomenal efficiency and analytical power of AI with the indispensable need for human oversight, ethical judgment, and the prevention of core human skills. So therefore, with this being said, we're going to take a further look into the ethical importance of AI.
Artificial intelligence is rapidly transforming healthcare, especially through tools that help clinicians make better decisions. But When these systems directly influence patient outcomes or access to care, we must ensure they are implemented responsibly. The implementation of artificial intelligence-based clinical decision support to reduce hospital readmissions at a regional hospital case study shows that ethical issues are not optional, they are central. Concerns such as data privacy, fairness and bias, transparency in decision making, accountability for harm, and even environmental sustainability must carefully managed when integrating AI into hospital workflows. Let's take a closer look at how these ethical issues appeared in this case. The model relied heavily on electronic health records, which introduces major privacy and data protection risks. Although some governance practices were mentioned, the case did not clarify whether patient consent was obtained or if access to personal data was monitored, leaving ethical gaps. Fairness and bias were also ignored. Without safeguards, AI can unintentionally disadvantage certain groups, whether by race, age, or health condition. Transparency was also limited. Clinicians and the patients could not clearly understand how recommendations were made. That raises the question, if harm occurs, who is accountable? Finally, environmental impacts were overlooked, even though AI significantly increased computing and energy use in hospitals. Now, beyond ethics, real-world adoption depends on how well the system fits into clinical workflows. Technically, the system was not integrated into the main electronic health record. Staff had to log into a separate tool, which disrupted workflow and reduced use. The AI model also produced false positives, which damaged the trust and raises concerns about reliability. Human-centered challenges made the situation even worse. Clinicians viewed the recommendations as too general, so trust was low. Switching systems also increased mental workload, and many staff felt they did not receive enough training or involvement in the design, thus contributing to resistance. Organizationally, clinicians believed the tool added more steps instead of saving time. Now, without strong leadership and motivation, engagement declined. Ultimately, successful AI implementation requires balancing ethical protection, technical integration, and human-focused change management. When these elements align, AI can support better clinical decisions and reduce readmissions, as this case demonstrated. But ignoring them can undermine the entire transformation. Now that we have examined the ethical and implementation challenges, my colleague will take you through how the outcomes of this AI system were evaluated.
One of the most notable outcomes was the decrease in the all-cause 30-day readmission rate, which declined from 11.4% to 8.1%, a statistically significant improvement. When adjusted for smaller gains at comparison hospitals, this equated to a 2.8% overall reduction directly linked to the intervention. Among high-risk patients, readmissions declined from 43% to 34%, a substantial improvement yielding a number needed to treat of 11. Across the total population, the NNT was around 30, still a meaningful level of clinical efficiency. From a performance perspective, these findings demonstrate that risk-stratified targeted intervention enhances both efficiency and outcomes. The model achieved 89% precision and 65% sensitivity, a practical balance accurately flagging high-risk patients while minimizing false positives and unnecessary work. For comparison, most machine learning models for readmission prediction average an AUC near 0.68. Thus, this implementation ranks amongst the best performing real-world AI CDS systems. What makes it innovative is its seamless integration of clinical and non-clinical EHR data into daily operations. It did not merely predict risks, It offered 26 evidence-based intervention options, such as patient education and outpatient referrals, advancing the principle of value-based care by directing resources toward those who benefit most. 4 operational lessons emerged. First, concentrating efforts on high-risk patients maximizes efficiency. Second, integration into routine processes, daily discussions, and discharge planning is essential for sustained success. Third, staff engagement and transparency build professional trust and adoption. And fourth, in resource-constrained settings, precision is often more valuable than maximal sensitivity, preventing system overload. This case demonstrates a successful linkage between predictive analytics and measurable clinical improvement. By reducing readmissions, optimizing resource allocation, and embedding AI within care processes, the study illustrates a practical evidence-based pathway toward more efficient and outcome-focused healthcare systems. We will now look at the comparative analysis.
Both articles had strengths and weaknesses. The main article successfully emphasized the integration of AI into healthcare workflows, delivering accurate predictions even when dealing with complex patient information. The research employed strong quantitative methods, enhancing its reliability and objectivity, and according to Babi 2021, quantitative methods are well suited for areas such as public health, since they depend on strong measurable statistical data rather than subjective perceptions or interpretations. The evidence-based information presented was a major strength. These all ensured the study's results were credible, data-driven, and replicable. However, the article mainly focused on readmission rates, omitting other key aspects like patient satisfaction or clinician satisfaction, as well as financial implications of AI integration. Other weaknesses were the short duration and the limited transparency of some core areas of the study. Therefore, it did not capture long-term impacts of AI in healthcare, which could help future research on the implications of AI integration in the medical field. As to the education article, the qualitative design was a major strength for CHIN 2025, as the article spoke on the adoption of AI within higher education to examine decision-making shifts and overall improve instruction. It allowed for rich real-world perceptions from real educators, which was another strength for the article. However, the study only included 7 participants, making it less generalizable and more prone to bias based on the small sample size. Similar to the healthcare study, this case also lacked analysis, but in regards to satisfaction of educators and students, as well as financial implications of AI integration within the educational field. Its short duration also limited understanding of long-term effects of AI use within the educational sector, all crucial information that contributes to AI adoption and aid in similar research in the future. We will now look at the similarities and differences of both articles.
The difference in approaches between the two studies is that within healthcare, the study assessed the reduction in readmission rates of high-risk patients, whereas in the study of education, it looks at the perception of teachers' experiences and attitude about the integration of AI. For the approaches taken, the Mayo Clinic Study 2019 employs the use of a quantitative positivist approach, and the Ancient Institute of Research 2025 used a qualitative constructivist approach. Regarding the use of technology, this was used in the Mayo Clinic in 2019 that gave the researchers the opportunity to use an AI-based clinical decision approach system with productive analytics and machine learning algorithms. As it relates to the outcomes, the healthcare study employed the use of a quantitative, measurable, and data-driven approach, whereas education employed the use of a qualitative approach with a conceptual and interpretive approach. Now we'll look at the similarities. In the healthcare, the focus was on the readmission of high-risk patients, and education focused on decision-making and personalized learning, exploring the perception of educators on the integration of AI in higher education. Regarding the approaches taken, the study focused on the use of AI as their central intervention, aimed at improving decision-making, efficiency, and overall outcome in their respective fields. We will now look at the use of technology. They both depended on data processing to analyze information, to generate insights and inform professional actions. And finally, the outcomes. Humans remain integral in making informed decisions and reasoning. And according to the Mayo Clinic 2019 and the Ancient Institute of Research 2025, they both stressed that AI should complement, not replace, professional decision making.
Finally, artificial intelligence has made a big impact in both healthcare and education. According to researchers like Romero 2020 and Chin 2025, AI has great potential to transform these fields, but its success depends on how well it's integrated with people, values, and professional practices, not just on the technology itself. In both areas, human involvement remains essential. In education, AI can help with tasks like administration and lesson planning, but teachers still guide how learning happens. In healthcare, AI can help identify risks and improve efficiency, but doctors and nurses still make the final calls for patient care. For AI to work well, professionals need proper training, engagement, and trust in the tools they use. When comparing two sectors, healthcare tends to focus on efficiency and measurable outcomes, while education emphasizes ethics, fairness, and human relationships. The key takeaway is that AI should support, not replace, human expertise. To truly benefit learning and healthcare, AI must be used ethically, adapted to its context, and always be guided by human judgment. Thank you.